what a great point. When the insurance companies are given that opportunity to profit off of our bodies, what happens? You know, I mean, we skip appointments, we skip medications, these things happen. What happens to the medical system when the insurance companies have their hands involved? We have some folks from Penn Yan that have come up here to help us understand that a little bit. You guys come up and share your story with us?
Yes.
So my name's Hannah, this is Laura, and we both organize with the Geneva Women's Assembly. So I thought I'd just tell you just a little bit about that work because it helps make sense of what's going on at the hospital in Penn Yan. So the Geneva Women's Assembly started about 2 years ago when one of the things we saw was that the future of the women's movement was really contested, and we wanted to make sure that the women's movement that emerged was anti-racist and trans-inclusive, anti-capitalist, pro-immigrant. And so healthcare has been a really important part of the work we've done. So I'll just highlight sort of 2 approaches to organizing that then I think will help make sense of the hospital fight. So one is we organize with the idea that building community power, especially in rural places, is crucial. At least where we live, people are used to just imagining that other people have power and exert it over us, rather than power something that we might be able to wield. So that's one approach we bring, and then the other is an emphasis on what we call social reproduction, but basically it's the idea that there's all of these ways that women in particular, but all of us, right, contribute things that we don't get paid for. And so here, healthcare is really important, again, as an issue that there are folks who are taking care of children, there are folks taking care of elderly parents, folks taking care of disabled siblings, managing insurance companies, managing applications for Medicare. All of that's unpaid work, right? No one's getting paid for any of that. And so part of what we try to do is politicize that work, hold it up and say, it's not just work in the workplace that matters when we're fighting for social justice. It's recognizing all the work, both activists' work, unpaid work, and paid work, that goes into keeping ourselves and our communities healthy.
So in Penn Yan, there is a hospital that it has 25 beds, and 10 of those beds are an inpatient psychiatric unit. And nurses who work on that unit were told that they were losing their jobs in about 6 months because they were going to close the unit. And so the nurses came to us as GWA because we've done some stuff in the past where we've built this like community power, and said no, that the people in Penn Yan and the surrounding areas need these services. They gave great insight there. They actually whistled blew about the admission process at the hospital. So we started to learn about ways that insurance wouldn't or would pay, about mental health. Like this is something that needs to be addressed at a time when the need for beds are increasing all over the country. This rural hospital plans to close the unit based on finances, or what they say, because there's no reimbursement. So we got to work. We held a community meeting where those nurses and community members came and talked about the ways that they needed the hospital and what it meant for them. And we developed we started to develop a plan to fight back and say that these services are essential and that we value people over profits. And just one side note, the group named themselves that, so it's really great to say. So they're starting to look at things like when a hospital is saying we can't afford to stay open, well, let's look at your salaries. And when administrators are making $712,000 a year, and then you say that you can't treat people who need a psychiatrist, then we have a problem with that. And so Hannah can update a little more about what we're doing now.
So I think some of the things we've already seen that are really exciting about this fight in Penn Yan are, right, it's a community of people who thought this was a done deal, where once they were able to come together, nurses, patients, community members, mental health providers, and say, oh, there's actually actually, there's a lot of us. We might be able to push back, and so we'll see the degree to which that pushback is successful. Our most recent troubling update, so if any of you have advice for us, we'll take it, is that while the hospital is not officially permitted to close the unit without their application for closure being approved by the Office of Mental Health and the Department of Health, they have nonetheless stopped admitting patients as of yesterday. So this like funny in-between space where they're following sort of the letter of the law, but actually no longer serving the community. So that was a disappointing setback that we'll keep fighting, and again, open to ideas here. But I think we feel really excited, no matter what happens, that here's a small, rural, often conservative community that has come together to say, we don't care whether the mental health unit is turning a profit for the hospital or not.
It's not supposed to.
It does. That's not what mental health care is for, so we're excited about the beginnings of those conversations in my community, and yeah, we'll take any advice you got about how to fight rural hospital closures.
Well, thank you guys so much for making this really much better. I hope you understand that, because what a mess. Reverend Bell, do you have a question?
One of the things that Paul Frazier, the individual that's part of our Poor People's Campaign in another region, has made statements on recently is privatization is very important to understand its dynamics, because any threat to privatization means assassination. So you have to be very tactical and inclusive in what you're doing, because it can come back to bite you. And so I just wanted to say that privatization has teeth, but don't be afraid.